world. This is Tea Talk with Nico and Cage.
I'm Nico.
And I'm Cage. And this is a treat. Hidden treasure of Youngstown. It's so sad that that's a hidden treasure, but it is. It's the Fellows Riverside Gardens. It's amazing. Okay, so we've been gone for a while, and we're sorry, but summer is busy and we is do wild and crazy, guys. We thought we would do another outside video before we lose the summertime.
This week that we are going to talk about taking care of your body and your mind, being as that we both have just had very interesting / traumatic experiences going to the gynecologist.
I guess most importantly, when your doctor tells you that you need to get examined, they mean it, and they're not just telling you that because they want to make money. When you're on testosterone, or I would guess even when you're on estrogen, but we'll speak from our standpoint. When you're on testosterone for longer than a year, you should probably think about getting into the gynecologist and thinking about if you want to get a hysterectomy and whatnot. You should probably start thinking about that at that point.
Even if you're pre-T, before you start HRT, you should be getting regular exams for your chest and your genitals, just because ovarian cancer is very, very, very difficult to detect, and usually when they do catch it, it's too late. And for the guys that are on T, unfortunately, one of the side effects of testosterone can be that it will cause ovarian cancer. So that's
get your shit checked out.
Yeah, it's a very real thing.
A good tip that I took from someone that you can take as well: take a lady friend with you that is a very close friend, if possible, your partner, lover, whoever, mom, whoever you feel comfortable taking, because that can kind of help some of the feeling of anxiety of sitting in a lady doctor office and feeling, uncomfortable being male.
I didn't take anyone with me. I went by myself, but I've had one exam prior to the most recent one that I had, and it was not any kind of pleasant experience by any means. I was actually kind of traumatized from it. Yeah. So I was so nervous going into this one because of just how painful the first one was that I couldn't think about anything else. I didn't care if people were like wondering, what is this guy doing signing in here and sitting here in the waiting room, and then my name gets called and I go back to one of the examination rooms. I wasn't even concerned with what people were doing around me because I couldn't think about anything else.
I had never had an exam prior, and I'm almost 28, so the doctor kind of looked at me funny when I said I'd never been examined. So for me, it was more the anxiety of, is this going to hurt? Am I going to hate it? I don't normally suffer from dysphoria, but it was definitely the closest to what people have described dysphoria to be for me. And especially if you don't use your lower parts for insertion, it can be very uncomfortable. But I mean, my best friend was there, and I mean, other than not knowing where to look, she was a great help in easing my anxiety, and we got lots of food after, so that felt great. Like we said, it's really important to go, and ladies, please go to your proctologist. Please get checked. Or urologist. Please get taken care of. Moving on.
Ladies, go to your proctologist. My dad actually was just diagnosed with prostate cancer.
And my dad's a survivor, so.
Yeah, and prostate cancer does not run in my family at all. My dad is the first one of all of the men in my family to have prostate cancer, so definitely get checked regularly, please.
Segue into mental health. I know that a lot of doctors do informed consent, and that means you don't necessarily have to have the blessing of a therapist to go and get HRT. Now, that being said, that's awesome. It's great that there is one less bar in the way, but admitting that you need help is not weakness. It's probably one of the strongest things that you can do. Even if it's just making sure that everything is working right upstairs, making sure that there aren't other problems that need to be treated as well as, being transgender. I just think that it's a really good idea. I didn't think I needed therapy, and then after going, I realized it was a good idea. to realize that this was the track I needed to take.
It's just nice too to have someone to talk to, even if just about anything. And it doesn't have to be serious. It doesn't have to be an emotional visit. It doesn't have to be awkward. The two, I would say, most important things about going back to the doctors and therapy is finding a counselor that you feel comfortable with. It's okay if you have to go to several different people to find one that fits. And same with the doctor. Obviously, if you are going to have them poking and prodding around down there, you want to feel at ease with them. So find a doctor that you like.
Honestly, I mean, know what your therapist or your counselor or your psychiatrist, whatever, know what they're capable of doing for you, and know what the expected outcome is on both sides, and make sure that that's clear. I went to a therapist back in like '06 when I first came out, and found out that she was not a gender therapist. She would have to refer me to a team of psychologists, and she wasn't even capable of writing a letter for HRT, which at the time it was necessary. So I wasted, out of pocket, $350. So please, 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 I know a lot of us have limited funds. Like Nico said, it's not a bad thing to go through several different doctors, therapists, whatever, before deciding on who you're going to go with.
Cage is going to the gynecologist that I was originally told about by another trans guy who was one of our friends. There was a big mix-up with her receptionist, so I didn't end up going to her. I found the one that I went to just through Googling trans-friendly gynecologist, and her name came up, and she's absolutely wonderful. So I'm really happy, actually, that I ended up going with her. Not that there's anything wrong with the doctor that Cage is seeing, but it just seemed like a really nice fit for me. So
yeah, for me, I know that I'm probably going to end up going to the other doctor just because I didn't feel comfortable, and I'm stressing that it's very important to be able to say that. I just kind of felt like pushed off. One of the things she said was that, you know, I wouldn't be able to do laparoscopically, but basically trying to get me to just get chest and everything else done at the same time when I told her it wasn't an option. She kind of brushed it off a little and, you know, basically said the words, it's not that I don't want to treat you, but, which tells me you don't want to. So it's just not a good fit. So I'll probably end up going to the other doctor, which oddly enough is the same doctor that was recommended to me by our physician, and we have the same GP. So
oh, Dr. Nichols recommended? Oh,
yeah,
nice.
Dr. Nichols actually works with her. So
oh, okay.
Yeah,
I didn't know that.
I know, small world. But I mean, all that being said, it's, again, really important to take care of your mind and your body because it's the only one you're going to get. That being said, I guess it's kind of a PSA from us, which, I mean, considering October's Breast Cancer Awareness Month and everything is coming up.
And my birthday.
And your birthday. My birthday's coming up too, but mine's first. So if you have things you want us to talk about since we're back, that would be great for a suggestion. We always, always, always are welcome to suggestions, questions. We'll tell you about ourselves in song and dance if you ask. So that about wraps us up here from T-Talk. Signing off.
I'm Nico, and have a good one.
I'm Cage. Take care of yourselves.